Well, look, medications are changed either by design or default, and by design it's hopefully because the clinician is responding to the individual either being really not well enough on the prescribed medication and or getting an unfair burden, if you like, of side effects. So that's the most common sort of scenarios in which medications are changed by design. When I say by default, a lot of people, and this isn't just about people with a mental illness, a lot of people either forget medications from time to time or decide to stop medications from time to time, and that can also perturb things. Psychiatric medications, as a rule, take some time. When there's a pharmacological way of looking at this, which is that it takes a certain amount of time for the drug to reach what's called steady state in the body, and that's a number of 5 times the half-life. But that's not as important as the individual response. And what we're still not terribly good at in psychiatry, as in a lot of the rest of medicine, I should say, is getting the right dose for the particular individual, or the right medication even, or the combination of medications even. So generally we would be saying to people, if they're starting on an antidepressant or a mood stabilizer or an antipsychotic, it's going to take some weeks to really show the benefits rather than days. So it can be a frustrating and exasperating process for everyone. It's a matter of knowledge. I mean, if the individual is okay about discussing this and the workplace is aware of the issues, then if there's a planned change in medication, that can be articulated to key individuals within the work organisation ahead of time. Of course, some people don't feel comfortable about talking about that in the workplace, and then it becomes more tricky. But I think the general things we were indicating earlier about how my workmates or managers might respond to noticing changes in people's demeanour, changes in people's behaviour, changes in people's routines, and how that might be responded to.
Plus, if the medication change means that the person is going to be struggling to meet the inherent requirements of the job, or that there's an aspect of their role that may be compromised by the change in medication, then they need to let their employer and co-workers know, and adjustments can be made for that 4 to 6 weeks, so they're not driving a forklift or whatever it is that may be at risk while there's a change of medication happening. And so the more information the individual gets from their doctor, and the more comfort they have in discussing this as routine workplace ergonomics, the better the employer and co-workers can build in adjustments for that period of time. Something that doesn't get mentioned enough is the loyalty that people with mental illness who are working have to their workplace. They often appreciate the value of work far more than the rest of us who mutter about having to go to the office every day, and I think that commitment to the job is such a significant bonus when a lot of employees who may not have the same attitude or relationship with their work, that I think most employers will feel it's really worth making those adjustments, being more accommodating to help that person ride through the turbulent weeks and the change.
Just picking up on something you said, Carol, I think the obligation of the individual to make sure that they're not doing anything which might endanger others. So, for example, if you are changing medication and you know the medication you're changing to might impair your concentration, then you shouldn't, during that phase, be doing driving machinery or obvious things like that. That's absolutely right.